has now officially been 6 months since I had my Ream and Run surgery, and I decided for this particular video, because I'm trying to make sure that these videos are a little bit different for the sake of entertainment purposes for you. I'm also a part of a study with the University of Washington, and they're evaluating my progress as I work along my recovery. And so they send me once a month this simple shoulder test, and they have me evaluate how my shoulder is doing based upon this particular test. So there's 12 questions on this test, and so I thought for the sake of this video and for my official half-year mark, I will do the simple shoulder test, and I'll walk you through the 12 questions that I get asked. Question number 1. Is your shoulder comfortable with your arm at rest by your side? My arm's at rest by my side. Feels good. Now, last night I went to a movie with my wife, and my arm ached a little bit sitting in this position for a couple hours as I was watching the Avengers. But sitting at the side, it feels good. Question number 2. Does your shoulder allow you to sleep comfortably? Now, that is an interesting question. I've talked to a bunch of people that have had my same surgery, and they're 4 months out, 5 months out, and they're still having trouble sleeping at night. Now, I've always had trouble sleeping, so I've always been a chronic insomniac, and that was one of the reasons why I eventually got my shoulder replaced, is because I would sleep wrong on my arm, and I'd wake up and my shoulder hurt. But I would say I'm able to sleep, but I wake up in the morning and my shoulder hurts. But that is because I take Ambien to sleep at night, so it's a little bit unfair to answer that question. But if I sleep flat on my back, my shoulder's okay, but if I sleep on my stomach, which is my tendency, and then my shoulder tends to hurt. So I have to position pillows in just the right place so that I can sleep at night. So that's question number 2. Question number 3. Can you reach the small of your back to tuck in your shirt with your hand? Can I reach the small of my back to tuck in my shirt with my hand? All right, let's try it. Does that count, Sky? So I say it's not the most impressive, but I can kind of do it. It hurts pretty bad. I would say there's a lot of tension right here, and it's pretty sore. But I guess I could technically do that. Number 4. Can you place your hand behind your head with the elbow straight out to the side? Okay, this is going to hurt. This is an exercise that I actually do where I'll lay flat on the ground and I'll put my arm behind my head, and my son will push on my arm and help stretch it out. So this is without any stretching. So here would be my normal arm. So you can go like this. You know, it's like a really nice pose. This is my model pose. It's called this blue steel. So we'll try it with my bad arm. How's that look, Sky? Does it look funky?
It's pretty good. Just do the other arm. No, can you do it at the same time? Let's see. It's pretty symmetrical.
Okay, good. Can you place a coin on a shelf at the level of your shoulder without bending your elbow? Since I can't seem to find a coin, I'll use a How I Met Your Mother DVD. So I'll put it straight out and see if I can put it on top of that lost DVD set. No elbow bent, not bad. Next one. Can you lift 1 full pound to the level of your shoulder without bending your elbow? I'll even do one better. I'll do it with 5 pounds. This is how much Sky can bench press right here. So let's see if I can do it. Now, that doesn't really feel great, but I can do it. Can you carry 20 pounds at your side with the affected extremity? All right. This is a 25-pound kettlebell. Carrying it at my side. Doesn't hurt at all. Okay, nice. Next one. Do you think you can toss a softball underhand 10 yards with the affected extremity? Then that's number 9. And then number 10 is, do you think you can throw a softball overhand 20 yards with the affected extremity? So come on, we'll go try that. All right, I'd like to point out first off that back in November when I started this process, this is exactly the way the weather was in November. And here we are, the end of May, and the weather is exactly the same. So here's Elijah. I would like to point out that my son Elijah was recently elected ASB president at Little Cedars Elementary. This is the second time in a row. Knock it off, dogs. These are the wild animals in the backyard. This is the second time in a row that I have written a speech that has won an ASB presidency. First for my daughter, now for my son. So underhand 10 yards. Okay. Ready? Is that about 10 yards?
Yeah.
Okay. All right, let's see if I can throw it overhand 20 yards.
But oh well.
All right, let's give it a shot. I haven't thrown since the last video, so here we go, because Elijah hasn't had any time for me. I don't think I'm going to be able to do this.
Oh. How'd that feel?
I give myself a C-, and that hurt really bad. Okay, the last two. Can I wash my opposite shoulder using this arm? And, you know, I bathe every day, so I'm able to do it. It hurts a little bit, but I can wash that shoulder. And then the last one is my shoulder enable me to be able to work full-time, and I've been back at work full-time for about 5 months, so we're pretty much good to go. It helps that I'm a minister. The only thing that it affects is my preaching hand a little bit. So I've watched a bunch of videos of me preaching lately, and I'm really overcompensating using my left arm, but it's getting better. So, right arm's feeling good. 6 months in, if I have this much improvement in the next 6 months, I should be good to go. So we'll see you again in a month.